What's up, ZBT fam? Today we're going to talk about and characterize spasticity following a neurological injury. Specifically, we're going to focus on spasticity following a spinal cord injury. Make sure you stick around until the end, where I'm going to share a bonus tip for you to learn how to manage your spasticity or train your patients to manage their spasticity. I'm Dr. Z, a neurological physical therapist, and on this channel, I give you golden nuggets. Whether you're a patient or a therapist, I teach you how to take control of your life following a neurological injury and the most effective ways for you to treat your patients with a neurological injury if you are a physical therapist. Alright, so what are we waiting for? Let's get started. First, we'll talk about what is the spinal cord and what its function is. Then we'll get into the path that a motor signal takes to cause a muscle contraction in a normal functioning neurological system. Then we'll talk about the difference between an upper motor neuron and a lower motor neuron. And finally, we'll talk about the reflex arc and how all of this comes together to contribute to spasticity following a spinal cord injury. Let's start by talking a little bit about the spinal cord. So the spinal cord can be thought of as a highway from the brain to the muscles, limbs, the rest of your body. So the spinal cord is actually an extension of the brain, and it's an amazing thing that the best way I can make it make sense is comparing it to a 5-lane or multi-lane highway. So the highway, aka the spinal cord, is responsible for carrying signals from the brain down to the rest of the body to cause things like muscle contractions, and it sends signals back to the brain for things like temperature and sensation. Well, in this highway, each lane has a different function. So for example, we have a cortical spinal tract, which comes from our cortex down to our spinal cord, and its main responsibility is to carry motor information. We also have a spinal thalamic tract, which actually carries pain and temperature sensation from the body back to the brain. So as you can tell by now, signals are constantly going from the brain to the body and from the body back to the brain, and it's happening at a lightning-like speed. So in an intact nervous system, a motor signal starts up in there in the cortex, it travels down through your spinal cord, and then it exits the spinal cord at the level of the muscle it's trying to cause a muscle contraction for. So for example, for the quadriceps muscle, which causes your knee to straighten, a motor signal starts in the motor cortex, travels through the internal capsule of your brain, down through the cortical spinal tract of the spinal cord, into the femoral nerve and the peripheral nervous system, and finally causes a motor contraction. Now, when the signal is coming from the brain down to the spinal cord, it is termed an upper motor neuron. An upper motor neuron is responsible for carrying information from the cortex down to the spinal cord. Once it enters the peripheral nervous system, it is now known as a lower motor neuron. Alright, so now that we've covered the spinal cord, an upper motor neuron, and a lower motor neuron, let's get into the reflex arc. So you guys can probably remember when you go to the doctor and they check your knee jerk reflex, right? They tap a little hammer on your patella tendon and it causes your leg to kind of jerk. Well, it should at least. What's happening is the whole concept of the reflex arc. So in an intact reflex arc, the stretch receptors in the patella tendon sense the hammer, cause a stretch, and those signals go to the muscle and quickly cause a contraction, and therefore your knee kind of jumps. Well, in a normal functioning nervous system, the brain sends signals back down to the muscle through the upper motor neuron to dampen the reflex and stop it from continuing. So the reflex arc is it is a lower motor neuron concept, whereas the control of the dampening of the reflex is a upper motor neuron job. So far, we've been talking about things in regard to an intact functioning nervous system. Now let's get into what kind of happens when there's a spinal cord injury. So when there's a spinal cord injury, a wide variety of things can happen depending on where the spinal cord was damaged. For example, if there's an injury to the back portion of your spinal cord, the posterior aspect, it's going to cause more deficits in sensation and knowing where your limbs are in space. Versus if there's an injury to the anterior portion or the front portion of your spinal cord, there's going to be deficits found in the sensation of pain and temperature, as well as voluntary motor contraction. So all the neurons in the spinal cord carrying information to and from the spinal cord to the brain are known as upper motor neurons. Well, in a spinal cord injury, these upper motor neurons can no longer effectively take the highway lane to where they got to get to. The way I describe it to patients in the clinic is that there's kind of like either a traffic jam or like the bridge is now separated and signals can't get over to the other side. That's where neuroplasticity kind of comes in, trying to reroute signals, building new lanes on the highway, detours so to speak, to let the signal get back down to the spinal cord. But this video isn't about all that, so I'm going to save that for another day. Now, why does spasticity happen after a spinal cord injury specifically? Like I said, there's a wide variety of things that can happen, but make sure you tune in every week so you can learn some more about those aspects. But in regard to spasticity, what happens is that some type of signal, majority of the time in the literature, it is described as a velocity-dependent stretch. However, the way I like to explain it or think about it is that some type of signal on the periphery of the nervous system, whether that be a quick stretch, a sensation of cold or heat, a pain response, something causes the reflex in the lower motor neuron portion to be activated. Now, in a normal nervous system, the knee will kind of bend, however, the brain is able to tell it to stop after 1 or 2 jumps. In an injured nervous system, the signal that's causing the reflex to kind of keep going isn't able to be dampened because the brain can't send signals through an upper motor neuron lesion to the muscle to help it stop. One way that we can dampen this hyper-reflexive response in someone with a spinal cord injury is through a long sustained stretch or long sustained input through weight bearing, for example. Some other things that can help with spasticity management include medical management through medication such as baclofen, which essentially depresses the nervous system and makes it less excitable to things like reflex or pressure or touch. Other things include Botox injections, which are injected into the muscle and last for a few months at a time through dampening the excitability directly at the neuromuscular junction. Surgery is an option in most severe cases, but that's kind of out of my wheelhouse, so I would defer to a surgeon at that point. And other things include things like orthotics for a long sustained stretch, more importantly to improve function without spasticity causing a fall or a safety risk, or just allowing someone to weight bear on their limb with having that extra support. Long sustained stretching has been found to have a significant impact in managing spasticity as well, although it has to be done more than once a day. Just like medication is taken more than once, stretching has to be done more than once as well. Alright, now for some more of the fun stuff. Well, it's fun for me, I'm a nerd, but we're going to get into a research article which actually surveyed about 1,200 patients living with a spinal cord injury in regards to characterizing their spasticity and how it impacts them on a day-to-day basis. This article was actually completed by Adele Field-Fote and colleagues. I actually interviewed Dr. Fote in a spinal cord injury podcast, which you can find on the ANPT website or in the description in the link below. But we talk a lot about her article and more about the structure and the thought process behind it. But today we're just going to talk a little bit about the findings from this article. So one of the major things that they did in this article was survey people living with a spinal cord injury. And they wanted to know, how do they characterize their spasticity? You know, in the clinic, whether you're a patient or a therapist delivering this information, you've probably said or heard that spasticity can be a good or a bad thing. It can help you stand, for example, or it can make transfers a lot harder. Well, patients don't really like to be told that because every person characterizes and experiences this sensation individually, right? So in this survey, essentially, the patient said that the majority of the time their spasticity is a barrier, that it causes pain. More than pain, they described it as stiffness. They said that it impacts their sleep, causes involuntary accidents with bowel or bladder, and only very few patients said that the benefits outweigh the cons. Another main cool thing that they found from this article was that patients actually described stretching to be one of the most beneficial ways to manage their spasticity. However, like I mentioned before, those that found stretching to be the most beneficial did it at least 2 times per day, majority of them at least 3 times per day. Now, baclofen, for when patients get prescribed it, they have to take it 2 to 3 times a day for the most part. So why wouldn't they have to stretch 2 to 3 times a day? Just like the therapeutic effect of baclofen wears off, so does the therapeutic effect of stretching. I'm not going to get into the weeds of this article, but if you want to learn more, you can check the link to the article and read the full article in the description below, or you can listen to the podcast episode on it. But the purpose of this video was just to introduce you guys to the idea of a upper motor neuron and lower motor neuron, and how a spinal cord injury can lead to spasticity. I want to give you a few tips to manage your spasticity, but if you're interested in learning more, feel free to email me at drzNeuropt@gmail.com. That's also in the description below. But I'm more than happy to answer any questions or help guide you through your journey living with a spinal cord injury. Whether you're a patient or a therapist treating those living with a spinal cord injury, I'm more than happy to be a resource for you. But that's all I have for you guys for this video. Please, if you liked it and you stayed this far, you must have. But if you liked it, please hit that like button and subscribe to my channel so you're aware of new videos when I release them by hitting that notification bell. And I'll catch you guys next time.